So we're going to be moving along to our next subject matter expert. We're going to be talking about the world forces gather to use AI to diagnose COVID-19. And you're going to be learning in this session how this idea was started by a Stanford student. Yes, a student at Stanford, and how you can build a business during a world crisis, learning on the job, can you do it all with almost no cash, and how to travel and meet people through Omicron, and looking to prevent the next pandemic and taking advantage of the network that is going to be shared with you here today. We're going to be talking to Amil Khanzada, founder and president of, if I say it right, Virufy AI. Hopefully, Amil will correct me if that is not correct. But after receiving his BACS in 2012, Amil joined Hewlett-Packard in Silicon Valley. In 2016, he joined Pivotal Software as a software engineer. And in 2018, he took a leave from work to move to Japan and was appointed evaluation ambassador and sent to One Young World Conference to represent Japan. In early 2020, he left his job to pursue graduate studies in artificial intelligence at Stanford University. When the pandemic hit, Amil committed himself to pandemic relief efforts and soon founded Virufy, a 501c3 organization developing a smartphone app to pre-screen for COVID-19 instantly through AI-powered analysis of voice and cough recordings. Amil is presently also enrolled in an MBA and a master's in engineering student at UC Berkeley, and his anticipation to graduate will be 2024. And without further ado, we welcome Amil Khanzada to the summit.
Guys hear me? Like the camera's not working for some reason. It's like really embarrassing.
Sure.
Is there
Well,
another
take your
way
time,
to
Amil.
go
If you want to just see if we can see if there's something.
Okay, this is like really weird. I'm gonna try joining from the app on the phone as well,
Sure.
and it might work.
Well, why don't you go ahead and do that, and I'm just going to ask for the audience if there is any feedback so far or any suggestions that you would like to share so far, as we are still early on here in the Nonprofit Healthcare Startup Summit. Any comments or any feedback anybody would like to share? Just looking here in the comments. So far, I just see, the recorded. Yes, this is being recorded. Again, you can find this on YouTube. So YouTube will be where you can access this anytime. And as we wait for Amil to get his camera ready, again, there's some great information here being presented. And I hope that a lot of this stuff that's being shared is helping you and where you are in this particular space. Again, if you have any questions, let us know. Feel free to reach out to us here in the comments section. All right. So we're going to wait for Amil coming back. Here we go.
All right, can you guys hear me though? Because I'll just start.
Yes, we can hear you, Amil. Yes, we can. You're coming in loud and clear. We just see your backdrop right now.
Okay. All right, I'm just gonna present my thing, and I don't know why this is happening right now. But,
that's okay. We can hear you loud and clear.
Okay, great. All right, let me share my screen. Okay, let's share the entire screen. Okay. Why is it happening silently? Okay, great. So, okay, everyone, nice to meet you all. So I'm going to present about my nonprofit. So this is me. At least you can see my photo. So I might be the youngest speaker, and this is my first time speaking in front of like a really large audience. So yeah, I did my undergrad at Berkeley. I did computer science. So that's my background, and I've also worked in databases and security software for a few years. And yeah, actually, when I was young, when I was 18, my dad was hit in a car accident. So actually, he was helping the society a lot. So that's kind of something that went into me as well. And yeah, and then basically, I was living in Japan, and they nominated me as an ambassador. So it's a very exciting thing. Oh yeah, so basically, this is a bit about my history. All right, so basically, I'll start by telling you about what the Virufy, our nonprofit, does. So basically, the whole thing during the pandemic was that the getting these like PCR and antigen testing took quite long, even in the beginning, especially because the manufacturing and distribution process was very you have to like ship these across the world. So to solve that problem, we thought, well, what if you create this app where you can just like kind of cough in your phone or talk in your phone and it will analyze your voice and tell if you have COVID. So basically, this would turn the phone of everyone in the world into like a COVID test. So then you could have your results in seconds, use it anytime, use it at home, anonymous, for free. And then you can have real time tracking of virus spread across the world and just push software updates if there's a new variant. And eventually, we're going to expand this into all sorts of diseases. So just imagine you can detect even depression from the sound of your voice and various things on your phone. So yeah, so basically turn this into that. So we were hoping that this could really stop the spread by just really putting real-time tracking across the world. So then the organization scaled quite large. It's been 3.5 years. So now there's more than 250 volunteers, a ton of partner companies, people from all the schools, like millions of dollars in pro bono services, and a ton of data. This is a key thing. We have more than 400,000 data points that we use to train our algorithm. So the advisors. So, I mean, there's several advisors, but like, for example, we have Dr. Atlas, one of the world experts in audio signal processing, Mr. Rafi, who's one of the top data privacy experts, United Nations representative, some Fortune 500 executives as well. So basically, as a nonprofit, a lot of really like kind and smart people gather to support me on this project. And then the partner companies. So I have several. So a lot of like medical insurance companies, technology companies. We have vendors, law firms. Amazon gave us a lot of credits as well. I do want to highlight Zur, who helped with. They're really managing our app development. They're based in Argentina. Nuvu in Colombia is managing our cloud infrastructure, and Sherlock helped us with the marketing. So really, we were really supported a lot by these folks pro bono. And currently our algorithm is about 84% sensitivity specificity. So if you compare that to temperature and antigen, that basically means that we have less false negatives. So if you're positive, we're more likely to not miss you than an antigen test. No, sorry, if you're negative. But anyways, with this is from the cough sound alone. So with more training of the AI model, I think we can go to above 90 if we combine the speech and the cough and symptoms data. So yeah. And then basically our differentiators, or as a nonprofit, we gathered a ton of really talented people. We have very strong AI team because just a lot of creativity of people from all the schools and huge data set. And then we have networks. So this One Young World, I'm an ambassador. So basically every year, 200 from all 200 countries, 2,000 young leaders are sent from each country, and the prime ministers and noble lords gather. And it's kind of a conference where they support the youth to make big impact in the world. So yeah, we leverage a lot of networks globally, especially the Stanford network as well helped quite a bit. Yeah, we have some publications. Okay, so now I think what people might be curious about is like, okay, how did I build this thing? So, okay, so basically, so yeah, like, yeah, I was at Stanford, so I was taking some graduate AI courses. Actually, my first course in AI was about 4 years ago. So this is the Stanford president. So, and then Andrew Ning. So I actually was able to meet them. He was my first teacher, actually, which is kind of nice. And I was thinking like, well, so like this is like my strongest power so far, like having AI, that's like amazing. So I'm like, then COVID hit and I'm like, oh wow, I got to do something about this. So then like what happened at that time, as you all know, there was a ton of these communities of people who were gathering across the world, figuring out like, how are we going to stop COVID? Let's do something about it. So I was one of those people, and I thought the idea, well, I've been into yoga and meditation, so I'm very aware of my breathing. And I'm like, well, there must be something different in my breathing pattern when I'm sick. And also, I going to One Young World, and when all the 200 countries, I saw like everyone brought a smartphone. So as you guys might know, like 84% of the world has a smartphone. So like, well, can we use a smartphone in breathing pattern detection with AI? Or so basically that's where I had the idea, like maybe if this could work, this could actually make a huge difference. So then I went to this thing called Stanford COVID Response Innovation Lab. So that was supporting a lot of Stanford students and community members to basically create their projects. And then my first two advisors, Dr. Meister and Dr. Leskovic, from Stanford Medicine and AI department, agreed to basically advise me. So then the project started. So then from there, it just kind of started growing a lot. I told people, like I posted on LinkedIn, I started building an HR team. The team started growing. So I started with one, like myself, right? Then it became 10 people, 20 people, 50 people, 100 people. And in parallel, I was also thinking like, which country do I want to focus on first? So I work with the One Young World Network, which is basically, they have these, I think, called coordinating ambassadors who are in each of the different regions across the world. So I contacted basically the Africa coordinating ambassador, Europe, Japan, US, South America, and basically kind of doing a global grid search. We had the most traction India, Pakistan, and South America actually in our beginning stages. So we decided to focus in those regions. And of course, the US, that's where most of our team members were. So then some people may ask, like, oh, why are you doing nonprofit? Like, so, because as you guys probably know, like most medical device companies are, well, actually, I think every medical device company is for profit, and we are a medical device. So it's kind of weird, right? I mean, well, the thing is, like, I mean, when I started this, like, my goal was never to make money. I just wanted to do like social impact and altruism. And am I talking? Everyone can hear me, right? Oh, good. Yeah, you can hear me. Uh, so yeah, basically, yeah, I just wanted to make impact in the world, and I didn't really have any. I was just like a developer. Like I didn't know about business and I didn't really have money. So I'm like, well, I just want to do this. So like, um, so basically, people just started gathering. I got volunteers, pro bono partner companies like free Google, Gmail, and even my Slack I got for free. And basically, it's like what I was able to. I couldn't have done this as a for profit because I didn't even have the skills to do that. And I never realized how hard it was actually to do this. I just had the idea, let's release the app, but then there's all these like clinical regulations and the FDA and all this stuff which I never knew about. So and then yeah, so this is like the interesting story. So the takeover attempts. So like it was like every like few months, like someone would come and say like, hey Amil, we should make this for profit and we're gonna get like super rich and blah blah blah. And it's like I it's like funny. I keep like telling them like no, like we can't really yeah, no, like I wanted to do this as nonprofit and like everyone gathered for nonprofit. And so it's like the first one was really hard. But then we got the pro bono law firm and then so I think we had to give them a letter actually, like, hey, like don't bother us. And then it happened again, and some other guy said, oh, you can like, oh, you're not smart enough or something. And it's like progressively like the age of the person who was trying to take over got older and older. And then eventually it's just like I'm like, yeah, like no, yeah, we don't really need to do that. Like so yeah. So then basically like so then yeah, so in South America we had a team and let's see. Oh yeah, so this was like in the beginning, and so then we got the powerful global team. So basically in the first, I think it was the first year, we had people from across the world. I wasn't really as focused in the beginning. I would just have people in like 20 countries, and then I kind of started focusing more in kind of regions where I had most traction. And yeah. Oh yeah, and then so then what happened? It was okay. So this was October 2020. So I started the thing in March, and in October, like I had a kind of epiphany because like some advisors like, hey, Emil, like you don't really have business skills, so like how like I never managed people before, so I didn't know how to do this. Like being like a CEO is like being like 10 ranks higher than like a developer, right? So I had like no idea what I was doing. So I'm like, dude, I gotta like learn something. So I thought, okay, let me apply for MBA school because that's where you learn how to do business. And because I'm doing computer science, I may be a technology business leader. So I applied. So that was in October. So I was applying to various schools. And then what happened is January. So then the company I mentioned, the Sherlock Communications, they were very kind. I met the CEO and they said, we believe in what you're doing. So they basically put out like, I think it was like 300 press releases. So like all across South America, we had a ton of press coverage about like, hey, we're building this app and we need people's help to basically contribute your cough samples so that we can train the AI algorithm to get this app out in the world. Yeah, so then, but when this happened, we had a flood of people contacting us, and I think like a lot of people joined the company, and then my team got a lot stronger. So this was like a key event in the beginning. So the team got stronger. And we kept developing it. Then in August, so this was, a few months later, I was accepted into the program at Berkeley. So I joined in August. So this was an interesting time. So I was a student, but I was also running the startup. But I learned a lot during this program because it was just a year before I had to take a leave of absence to focus on the startup. But like, people are very kind to me, and I started to meet all these people who knew a lot about business, which I didn't know, and the professors. So it was great because what I was learning, I was applying immediately as I ran the startup. And yeah, and then it was nice also. Like, so once the restrictions got a bit lower, I started traveling. So it was actually pretty nice because like during the Omicron surge, I was like taking a lot of airplane flights, and like no one wanted to fly, and the hotels were really cheap. And I was just like a student, like without really money, so it was nice. So yeah, here's our team in Colombia. We got the flyers and everything, and they were helping us collect data from patients because they were doing PCR testing. These are our team in Brazil. Um, and very kind. Yeah, these guys were lawyers actually, which is funny because we worked on the data privacy laws. Um, and yeah, last year, actually, around in the summer, I started the Japan team because I was finally able to come to Japan. I think the restrictions, yeah, I needed a special visa, I think, actually, to come in that summer. And yeah, I know Japanese fluently, so easier to move here. Um, yeah, and I'm actually in Tokyo right now, and it's like 11 p.m., so I was a little sleepy. Okay, so yeah, another thing that happened so earlier this year, so we finally got to a point where we could release the app. So we were working with this large medical insurance company in Colombia. So then we basically we said, okay, great, we've got the app to this point. Let's do like what am I trying to say? Like a beta app release. So basically, what we agreed upon is that we would all 4,500 of their employees would have access to our app, and basically people who were flagged at high risk of COVID would go get a PCR test. So we did a lot of time with them, about 6 months. So we concluded this in last month because COVID dropped. But basically, it was a good 6 months where we really worked out all the bugs and kinks in the system. And yeah, and if you guys don't know about Colombia, it's like here in South America at the top here. And they have this like really nice thing called guanabana. So I went there like I think 5, 6 times. It's a really nice fruit. Yeah. And okay, so I'm gonna leave more time for questions, but so basically one thing I'll say is like we need your help. So basically this whole Virufy project was done by volunteer efforts. Oh, we did have one government contract with the Human Health Services, which was quite good as well, but a few $100,000. But basically, we've not really had money. So yeah, one thing, if people like want to donate money, we are a 501(c)(3), so we can give the tax receipt. I also am applying for a lot of grants right now. I'm surprised how much funding the U.S. government has actually, like NIH, NSF. We also need volunteers and partner companies who want to help us pro bono. So we can't pay right now, but basically like one thing is we do want to collect more cough samples of people who have like COVID or tuberculosis or flu or asthma, different diseases, right? And so we can train our AI models. We want we are working on our new website. So some website like a company who can do website development. Of course, we could use more AI developers, DevOps, HR people into recruiting different things, marketing people, project management, tech, all sorts of tech stuff, grant writers. So these are kind of the things we're looking for. Okay, so I will. I guess I'll stop sharing. I don't know why my video's not working, but yeah, maybe we can have some questions.
Great. Well, Emil, thank you so much for sharing. Great insights. Thank you for your time. No worries on the camera. There
Now
we go.
it's
We can see you
working.
now.
Okay, I think it was like the antivirus or something. Okay.
We can see you now, so you're fine. So we have a couple questions that did come in. First of all, thank you again for sharing. It was great insights. How did you develop AI for COVID-19 diagnosis during the crisis?
How did I develop it? Well, so yeah, basically what happens is that we gathered the cough samples and of people who were PCR positive and negative for COVID, and then we trained the AI system to basically differentiate positive and negative, and then that was what we integrated into our app.
Oh, great. And another question that came in, what lessons did you learn about AI's role in diagnosing dynamic diseases?
AI's role. Um, I mean, like, well, so the thing is that actually, one interesting thing is that in the past, there were a few hundred groups working on this problem, but no one got FDA approval. And the reason is because like no one got above like 90%, which is apparently what FDA needs to see to approve. I mean, antigen got through it because of the emergency declaration, which is over. But so basically, what I learned is that I mean, AI is not at it's not at that level yet where or the science has not gotten strong enough yet. So we really need a very strong collaborative approach to get this because everyone's like trying to work alone right now and no one really shares their data and algorithms. So that is actually one thing we're pivoting towards, which is an interesting direction to get a collaborative force behind this to push this through the FDA.
Okay, great. Thanks for sharing. And this is exciting. I mean, in terms of what are the, I mean, just my question, what are the next steps for you in terms of where you are and where you're going? I mean, could there be another pandemic? I mean, you hear that speculation that another one could be right around the corner. We just don't know in this uncertain world we live in. And what would those next steps be?
Yes, I mean it may be happening right now. I mean a lot of people are getting COVID, but like because their testing's not really happening, we don't really what is it like we don't know where the spread is happening. So one thing is kind of like it would be exciting like if this app is available across the world and then even if a small percentage of people are even putting their coughs, there can be like real-time tracking across the world of indications of a next pandemic or yeah stuff like that. Or helping monitor COPD or asthma or something. Or early detection of lung cancer is also quite interesting.
Yeah, I think that I mean so many things with cancer, like you said, and other types of diseases. I think this could be really powerful and so important. Anything else that we still got a little time here. We still got about
Mhm.
4 minutes, and like anything else that you would like to share that could enlighten everyone that is listening live right now, and those that are also will be watching later here on YouTube as well.
Oh yeah, like I mean I don't know, it's been a really fun ride. I mean it's like oh yeah, the network. So I mean yeah, like how to say it?
Yeah, and you can address that other question that just came in if you want to address the network and that you can
oh
do as
yeah,
well.
yeah. Yeah, so I mean like so I think nonprofit was really the right choice and I don't regret it at all because it's like so easy to get help and people know like I'm not here to get rich and it's like and if I was like working with a VC or something they're just like gonna strangle me and like when are you gonna exit and give us 100 times back our money and it's like um so I got to meet like a prime minister. I got to meet like the chairman of one of the fag companies like a couple times who's also interested to support me and it's basically like these like how to say it like once these kind of people support like the level of advice they give like I have this huge every time I need something I have different advisors who can help me like work through these really hard problems and or they can introduce me like for example like we did a few 100,000 samples we collected in partnership with the chairman of the largest medical insurance company in one country. So just like a massive ripple effect. Like he introduced like 10 companies and basically all their CEOs assigned their staff to kind of work with us and make this happen. And um, yeah, so it was kind of cool.
Wow, that's great. That's great. And I
Mhm.
see here in our private chat box, we have somebody that was reaching out to say, hey, how can we partner to support? So
Oh,
that's a good thing. So maybe you could take that
uh,
offline and,
yeah,
and
yeah.
see where that goes from there. Yeah, no,
Yeah,
it's
just
exciting with this. And in terms of, you're a 501c3. I love that fact. I have a 501c3 as well. And, there's always going to be pros and cons to which way you set up. But, in this way, from what you just gave us, this was your best choice for what you felt, what you were looking to do.
oh yeah, and also another interesting thing is that like I really leverage the academic networks a lot. So I mean,
Yeah.
so it's kind of like I mean, it's just because like it's open. It's like open for everyone to kind of join, and so I got a lot of students, and then the students like pulled in their professors, and I mean now we're applying for different funding at Stanford and MIT or wherever it is. There's all these, and then the alumni networks like they really like to support their students and stuff. So I think that's like actually really powerful. Honestly, I feel like we can reach anyone at any level in any country. Like, so the network's like huge.
Yeah. Well, I know with Stanford, when you mentioned because you went to Stanford. Stanford's got a great program for that. I've done me personally. I've done some things with their graduate group in terms of storytelling. They have a group there, and I'm not even a Stanford alumni, and I feel like I'm part of the family just because I've been included in their storytelling groups and so on as a speaker. So yeah, so great to hear. It's exciting to hear all the great things that you're doing here. Any other final comments that you would like to make before we move forward?
Oh yeah, I guess like another thing like my work ethic, I'm quite into like mindfulness and stuff. So like to really have like a high like how to say it like when you're a leader of a organization, your energy level and your that affects everyone actually. So
Mm.
like really taking care of myself is important for the entire organization and also just like also being like grateful to everyone and having like these like awards and stuff that we give to people. I mean even small what I didn't realize is now like even a few small words I say can really have a big impact on people and I'm like yes, I have to like kind of be careful what I say and stuff like that. So it's interesting.
Yeah.
Yeah.
Well, Emil, I want to thank you so much for taking the time today to be with us. You shared some great insights, and we encourage everybody that is listening to reach out to Emil, get connect with him on LinkedIn and some other areas that you will see on the website. And again, Emil, thank you so much for your time.
Okay, thank you. Yeah.